Let's shift the gears here because a lot of you are talking about this today. A Cowboys legend terrified right now over a pending diagnosis. Michael Irvin revealed to the world that he is right now undergoing tests for throat cancer. What makes this even more scary for him is it's the same type of cancer that he says killed his dad. We want to point out that as we talk about this right now, at the bottom of your screen, you're going to see some of the well wishes for the former Cowboys wide receiver. A lot of people keeping him in their thoughts and prayers. Now, the Mayo Clinic says that throat cancer is rare. They say there are fewer than 200,000 cases a year. Still, if you're potentially one of those cases, it can be a scary thing. Let's talk more about it right now with the symptoms and the signs and all of that. This is Dr. Jared Sturgeon. He's a radiation oncologist at the Texas Center for Proton Therapy. Thanks for being with us today. Thankfully, this one is somewhat rare compared to other cancers, but I was curious, and we were talking a little bit about this during the break there. What is the prognosis for throat cancer?
So in general, that all depends on how early we catch the cancer. Often for throat cancer, we catch it pretty early and patients can have a very good outcome. With very early throat cancer, about 90% of patients are going to be cured. More advanced cancer, though, patients have a difficult time, but many of them still do well.
Wow, that's really good news here. So if you catch this early, you're saying 90% can be cured. Interesting thing here with Michael Irvin, he says that he was actually cheering on his former team. He was cheering on the Cowboys, and he noticed that he went hoarse. He wasn't able to speak. Is that considered something that you usually see if it's an early case?
Yeah, so hoarseness is one of the early signs we often see with this cancer, and it's a good thing because it shows up pretty soon. We catch it early because people have symptoms like hoarseness or sore throat, and so they get to their doctors sooner rather than later.
Because it's affecting their day-to-day life, obviously.
Yeah, exactly.
Is there anything to this if this kind of cancer killed his father? Do we know if this is one of these that is hereditary or no?
We don't have good information on that. Most of these are not hereditary.
Okay, but obviously I could see how that would add a whole lot of fear for you if your parent had gone through that and now you're experiencing a similar symptom. This symptom, though, that he's experiencing here with the hoarseness or sore throat, that could be so many other things too. So
yeah, and most of the times it is something else. Most of the times it's just benign. You go to your doctor, he checks you out, and you're fine. But it's still good to get checked out if you're having it last too long.
We can only imagine the difficulty for Michael Irvin as he's awaiting these test results. Is this something, for those of us who've been fortunate enough to not have to go through something like this, is this something that typically takes a day or two, a week to figure this out, exactly what he's dealing with here?
So there's basically 4 big tests he has to do, and he's done at least 2 of them. They have to put a camera down your throat, and then they do the biopsy, which he was reporting on. And then there's some imaging they do, and you're done. So it can be done in a pretty short amount of time if you're aggressive about it.
Well, hopefully we'll have an answer soon, and hopefully it will be a good answer here. What is the treatment regimen for something like this if indeed they do detect that it is throat cancer?
So the goal for these type of cancers is we want to preserve your throat, right? You want to be able to talk, you want to be able to swallow, do normal things. And so our goal is usually aimed towards that. So for patients who have early cancers, they'll do something as simple as get a laser treatment to the cancer. Other patients may just get radiation. And for more advanced patients, we try to preserve the organs with chemotherapy, radiation therapy, and then in some cases a big surgery. And part of the reason to preserve that is so they can have a normal function of life, and that's one of the things we try to do when we treat these patients with proton therapy.
Whether or not it turns out that Michael Irvin has throat cancer or if it's something entirely different, it is sort of brave, I think, to go out and talk about a fear that you're facing and something that you're going through, especially when you have that kind of name recognition. And I suppose it is good that it at least brings some awareness about this cancer because, again, it's kind of a rare one that most people might not think about too much. But if you're having some nagging symptoms like the hoarseness and inability to speak and the sore throat, obviously you'd want to get that checked out. Sometimes it's more than just strep or a sore throat or something.
Yeah, it's great when celebrities do this actually because lots of people who just have these symptoms, they go to their doctors, they change the behavior and they get diagnosed and they have a better chance of being successful and putting this behind them.
Well, we will certainly hope for the best. Dr. Jared Sturgeon, thanks for being on with us today.
Thanks so much for having me.